Well, good afternoon, everyone. This is Keith with Positively Osceola, and welcome to yet another episode of Positively Osceola's Coffee Club Talk Live. And, we really do welcome so many different guests, and we're honored to have just a vast array of them that are just amazing people out in the community doing amazing things, and but none more amazing than these two gentlemen right here. And today we have with us from Orlando Health, Dr. Luke Elms and Dr. Bobby Gibbons. How you guys doing?
Great. How are you today?
Well, thanks for having us.
Well, we're leaning toward a big holiday weekend, so I'm hoping at some point it starts to feel like a little weekendish. But right now, I'm assuming you guys are quite busy at the hospital.
Yeah, the end of a busy day.
Yeah, been working all day and ready to talk about some hernias.
Something everybody's doing today around 5 o'clock.
Yeah.
Well, we do appreciate you coming. We're seeing some people pop on right now, so we will we'll get started right off the bat, and we'll make it official. Here we go. Well, welcome back again. And I did have somebody ask if we would turn your mics up a little bit, if that's possible from your end. You can certainly wait a second.
Anyway, we can turn the mics up a little bit.
Yeah, that'd be good. As you go. We'll keep on going. So, again, we really are appreciative that you would take the time today. We know you're very busy at the hospital at Orlando Health, and we'll get right at it because I know this is a big subject, and so we'll go right for it. So more than 1 million hernia repairs are performed each year on people in the United States, and even more people are just living with hernias. With this month still being Hernia Awareness Month, physicians at Orlando Health, Dr. P. Phillips Hospital, want to keep the public informed on the types and symptoms of hernias and exactly when they need to see their doctor. So today, again, we're very excited to have with us general surgeons with Orlando Health, Dr. Luke Elms and Dr. Bobby Gibbons. Glad to have you guys here.
Thank you.
Thank you for having us.
So we'll lead off with Dr. Elms. Go ahead, just tell the audience a little bit about yourself, how you came to Orlando Health, and what you do at the hospital, please.
My name is Luke Elms. I'm originally a farm boy from Oklahoma that went to medical school down at University of Oklahoma, and then came out to Orlando Health for training. Did a 5-year surgery residency and came down to Dr. Phillips Hospital afterwards, where joined a practice, and we do a lot of general surgery, including a lot of hernia repairs, and focus a lot on minimally invasive techniques.
And Dr. Gibbons.
So I have lived a little bit of everywhere, through abroad in the Southeast and Midwest, and I also landed downtown at Orlando Health for my surgery residency, and now very similarly in general surgery practice, do a lot of hernia repairs and focus on minimally invasive hernia repairs.
Awesome. Well, we'll like I said, we'll head right into this. So for those in the audience who have heard the word hernia but know nothing more than that itself, let's get right at it and explain what is a hernia.
Well, I think that's a good question. I think it is something that's very common knowledge, but has very specific definition. The body wall, specifically in the abdomen, has areas that provide strength and hold everything in where it's supposed to stay. Mm-hmm. And there are different areas of the body wall that have natural openings that are used, for instance, when we're a baby in the womb, where the umbilical cord attaches, or where things descend as we're growing up. And those are natural holes that usually over time close down. But unfortunately, sometimes they don't close all the way, or they become dilated over time. And then there's also holes that are created by injuries or by us performing surgery and having to gain access inside the abdomen. A hernia is where the structures that are inside that strength layer can be forced through into those areas that they're not supposed to be. And the real danger arises that things can get stuck and cause an emergent situation.
Understood. Any other input at all?
Yeah, that's the basics. Every time you have a spot that things move through where they don't belong, you're at risk for things getting trapped, and that's our job as hernia surgeons to put things back where they belong and patch the holes up to try to prevent it from happening again.
And so, I tend to, uh, I somehow I tend to hear, when there would, whether it be some kind of an informative commercial or what I see things on the television about hernias, but I don't really, I don't know how common this really is. Is it common, or is it rare? And does it happen to both men and women?
So hernias are very common, actually. You mentioned at the offset that upwards of 1 million hernia repairs are performed each year in the United States, and as many as 5 million a year are diagnosed. And that's not counting the people that never actually present to be evaluated. They occur in both genders. There are certain areas that are more common in men. In particular, the groin is more common in men than women.
Yeah.
But both can have it in the groin, and both can have it at incision sites, the belly button, or other places.
And so, and it may sound somewhat silly, but what are the symptoms of a hernia? How do you know if you're having that situation, if it's a large scale hernia or just the beginning of some type of hernia?
The symptoms can really range between very subtle to very obvious. We see people that come in and say, I used to have an innie belly button, and now it's an outie and it protrudes, and that has been getting larger over time, and I can see things moving in and out of that space. And those are fairly obvious symptoms, but there can also be more subtle symptoms. Many times, uh, uh, men will complain of testicular pain. They may experience a pressure in the groin or a feeling of something moving that is not normally felt there. And similarly for women, they can also feel those types of symptoms of just a dull ache. But a lot of times people also see the bulge and know that there's something different than there was before.
So one of those moments where you say, "What is that?" Basically, right?
Absolutely.
So something I did not share prior when we were talking earlier before we're going live. So I am also a saxophone player, and many, many years ago, I was playing one night, and I had that particular scenario where I said, "What is that?" And it was actually a hernia. So, unfortunately, speaking from some experience in this,
Sure.
well, I was going to ask you the different kinds of hernias that you see, and I think you kind of almost answered that. So, how about I flip it a little bit and ask you: is there a certain age range that is you see it more prevalently?
So it can actually occur across all age ranges, and sometimes for different reasons. So we see it in young children for things not closing as they go through development and being noticed and noticeable. And then as we get into the older population, we see it in you know younger adults who are healthy and active and putting stress and strain on their bodies as they go through life, opening up these pathways that had previously been closed. We see it not infrequently in women of childbearing age. The pressure increase from pregnancy can lead to these manifesting themselves. And then on throughout life, it can really show up in any age group.
And so I think part of the reason why we're having you here today is hernias 25 years ago, 20 years ago. I'm assuming were addressed differently, perhaps, than they are today. So if there's a difference in how you handle them now, why don't you go ahead and share?
Well, I think that over the course of not just decades but centuries, we've been treating hernias, and it's, there's medical literature from a long time ago that details very specifically these types of phenomenon. And so, I think that over the course of time, we focused mostly on what we call a tissue-based repair, where we essentially use a suture and sew your natural body planes back together to close the opening or to decrease its size to a normal size where things are sliding through that shouldn't be there. And what we found is that for the most part, these hernias came back at a very high rate. And so over the course of time, the idea was that, well, this tissue is not really that strong to begin with, and that's why we are having the hernia. Maybe we need to reinforce it with something. And so over the course of the past few decades, that's when mesh really became a very commonplace use, because it does decrease the risk of hernia formation after it's been repaired or recurrence of those hernias. Uh, most people's understanding of hernias a lot is very derived from seeing articles or reports about problems with mesh. And so we get that question a lot. And I think that, mesh, when used appropriately, that has been tested and tried and true, is a very safe and a necessary method of repairing hernias to try and prevent those recurrence. Because hernias, when they come back, they don't come back smaller or the same. They usually come back bigger and badder. And so really, you really want to have a good surgery the first time and let it and be done with that. Over the course of time, we started doing these in an open fashion where we make bigger incisions and go down and sew it closed by hand. And then we've progressed over time to more minimally invasive methods.
Yeah, and so today we utilize laparoscopic and robotic surgery, which is maybe heard called keyhole surgery or minimally invasive surgery. It's small incisions to gain access to the spaces inside the abdomen and the abdominal wall. And then we use a camera and our instruments that go through these small areas to be able to perform the same kinds of repairs that we would previously have performed open. The fundamental repair doesn't change. You put things back where they go. You sew the hole closed and you reinforce that area to try to prevent this from recurring. But we're able to do it now frequently with smaller incisions to improve recovery. There's certainly still the role for the traditional open repair, depending on some patient-specific circumstances. But this allows many of our patients to return to their normal daily lives much quicker.
And that's the whole point of the scenario, right? I know we have, I think I have a couple friends that are just simply putting that off. They're well aware they have a hernia, and they're well aware that it could, continue to progress and become, much more dangerous. But it's still something that people will tend to put off. So it is uncomfortable to have a hernia. It can be painful to have a hernia. So let's discuss, the procedure that you're doing these days, and share. I've got to assume, because I know it was for me. It was a much better outcome than what I was living with. So go ahead, if you could share with us what a patient would expect when they have surgery for hernia, and then whether it's a pain situation, at what point, how long is that recovery going to look? What is that going to look like in a recovery sense?
Absolutely. As Dr. Gibbons mentioned earlier, our progression to more minimally invasive techniques with both laparoscopy and the robot have allowed us to do surgery through much smaller incisions. And while that does absolutely decrease the pain and increase the quickness with which a person can return to normal activities and feel back to themselves, it does still hurt. And so I think that that's a very important point, is that, surgery is surgery, no matter the size of the incision. And so to expect to have some postoperative pain is normal. We have made great strides in the treatment of this over the past few years, especially in our practice. One of the focuses of our practice is to try and limit or eliminate the use of opioids in the recovery process, as we are in the middle of an opioid epidemic that is just ravaging our country on a daily basis. We have been able to utilize medications that have been around for a long time in combination with one another to try and give people a recovery where they may be sore, and yes, they will know they've had surgery, but they're able to get around and do their normal activities, such as get back to work in a timely fashion, whereas it used to be closer to 6 weeks before people could even return to their work. We do still have a recovery period where we ask patients not to perform certain strenuous activities, but even that has become much shorter as we've moved into the more robotic platform, and even that is decreased from 6 weeks or longer down into the 2 week or less range in a lot of cases. So I think that it's important to understand that, yes, there is going to be pain during the recovery, but usually we tell people that after 6 weeks, you're probably going to feel back to your normal self for the most part. There is a certain level of people that may experience the pain longer, and there are people that we see that are raring to get back to their normal life in a couple of days. So I think it's a wide range, because patients' experience of pain is a very wide range of individual experience.
Yeah, it's great, and I loved hearing what you said about the post surgery medication. Certainly, that's That's a big deal. It's great to hear you talk about that. So if someone is, if, they hear this and they're saying, I think it's that time. How do they reach out to you and say, look, I'd like to just, have a consultation and discuss surgery, discuss what my situation is? What's the best method for somebody to do that?
So there's a couple of different ways that you can reach out to us. One is you can go on orlandohealth.com on the website. There's a physician search. You can type in either of our names. You can get the phone number to the office that way or schedule appointments directly online. You can also call the office directly. It's 842-1202 to speak with our office about getting a consultation scheduled. Our office is based here at Dr. Phillips, but actually we are in the process of reopening our satellite office down in Osceola County at the freestanding ER that Orlando Health has there. We were occupying that space for a little over a year, and in the midst of the pandemic, pulled back a little closer to home and are looking forward to expanding back that direction as well.
Awesome. So anything we didn't discuss today that you'd like to share with the audience? I know that's not the only thing you do at Orlando Health is hernia. Anything else you'd like to share at all?
So, in terms of what all else we do, we're broad-based general surgeons. We do everything from hernia repairs to gallbladders to intestines to breast surgery. So any questions you may have, feel free to reach out. Additionally, for folks who do have a hernia, as Dr. Elms mentioned earlier, these things, when they recur bigger and badder. They also don't get better on their own. They tend to get larger and more symptomatic over time. And certainly can lead to emergent situations. If you think you may have a hernia and have never been evaluated, it's worthwhile to go see somebody. Not all hernias need to be fixed, and not all of them need to be fixed right away, but it can be hard to make that decision if you're not properly informed.
And we do have another office line if the first one's causing problems. It's 407-354-1202, and that'll take you directly to our scheduler, and they'd be happy to get you in to see us.
Awesome. And I will. I'll make sure that I add that into the text in this post for sure. And I think you make the point clearly. And if you're having a question of whether you're experiencing the beginnings of a hernia, sitting back and letting it progress, probably not the best idea. Look for somebody who knows, as you both do. And so that's probably the biggest takeaway from today. Reach out and have somebody like yourselves be able to give you that straight ahead answer and get a plan going. I know that I think I probably waited a little bit myself in the beginning, and it's just not the way to go with any of these things, really. Any of the surgeries that could be potentially becoming worse because you're putting them off. So we really appreciate your help today. We've had a lot of people ask us questions in this realm, and so great that you could spend a bit of time with us. I know you're both very busy. And so we really super appreciate you guys coming over today and just speaking with us.
Thank you for having us.
Thank you so much.
Great. Again, on a beautiful Wednesday at 5-ish, we thank both of the doctors today, Dr. Luke Elms and Dr. Bobby Gibbons. So again, this is Keith with Positively Osceola, along with Orlando Health physicians. As I said, Dr. Luke Elms and Dr. Bobby Gibbons, along with the community. We are making a positive difference in and around Osceola County. Thank you, doctors.
Have a good evening.